Dan sementara itu, antara isu utama yang dijangka dibincangkan dalam rundingan TPPA di Brunei minggu depan adalah kesihatan dan juga ubatan. Isu ini telah dibincangkan berterusan dalam rundingan TPPA sebelum ini. Isu ini dibangkitkan selepas wujud kritikan berkenaan paten ubat umum yang dijangka diharamkan. Dan bersama kita untuk membincangkan perkara ini adalah pengurus polisi Malaysian AIDS Council, Fifa Rahman. Hi Fifa, thank you for joining us. Now first of all, let's talk about the statistics for Malaysian consumers, right? When it comes to consuming medicines, 80% of the medicines consumed by Malaysian consumers in that sense are generic medicines, and if the generic medicines are to be taken off the market, they might have to pay up to 1,404% increase in terms of price of medicines. Is this a real danger? Is this a real threat if we were to go forth with the TPPA ratification?
Oh, most definitely, it's a very real threat, and we have had a look at the leaked texts of the intellectual property chapter, which is the one affecting medicines, and you're looking at it and you're thinking this is going to severely restrict entry of generic medicines into the market. It's just basically going to delay it. And when you think about the average household income of Malaysians, it's about 4,000 something ringgit, and these are government statistics. It's just maddening how people are going to have to pay patented prices, which can be up to double or triple of their household incomes.
And what kind of generic medicines are we looking at right now? Because I think maybe you can share with the viewers what are the generic medicines that they are paying at a very low price compared to the original patented medicine, which can maybe cost much higher.
Okay, well, I'll give you the example of HIV, because at the moment for first-line medicines, all of them are generic, and before that it costed much more, almost 5 times more. So right now it's the HIV medicines that are procured by the government are all generic, and they're 1/5 of the price, and the government saves a lot of money from that.
And you are also part of the negotiating people in the negotiations, right? And you've also went to the stakeholders day, if I'm not mistaken. What are some of the issues raised by stakeholders when it comes to issues of patented medicines and healthcare in that sense?
So I attend the negotiations as a stakeholder, and the main issues that are raised in regard to medicines is the patent extensions. So we know that originator medicines, they have a patent for 20 years at the moment. So what they want to extend that by 5 years automatically, and if there's a new use or new form of the medicine, so if they change it into liquid form, or they make it heat stable, or you can eat it the whole day without food, or change it in some form, it tracks another 20 years. So the patent extensions are insane. It could be 20 plus 20 plus 5. So that's 45 years of you not getting affordable medicines. So that's one of the issues. And the next one is data exclusivity. So data exclusivity means that the data about that medicine is exclusive to the originator company. So even if we have a public health emergency and the government orders the medicine in by virtue of what is called a compulsory license, because that is used during health emergencies, order the medicines in, medicines arrive at Port Klang, but because of data exclusivity, it can't be registered. And when it can't be registered, Malaysians can't use it. So basically, I always say it's a trade agreement that kills, because the medicines can't reach the people, unless, of course, you use the originator medicines, which we can't afford.
And a huge number of Malaysians, I assume, are not covered under health insurance, which will make it harder for them to access expensive medicines if this were to go forth, right?
Yes, I think so. Even for cancer, for example, colon cancer, I know someone with colon cancer, and he's covered by health insurance, but if he did not get health insurance, he would have to pay up to 10,000 ringgit a month for his medication. And I can't afford that. I don't know I mean, only the rich can afford that, so it's basically killing the poor.
We don't have anything to base on right now, because the TPPA has not been implemented, but as we can see from previous free trade agreements done by Americans with other nations, has it always been a negative thing?
In terms of medicines, there is actually evidence that medicines prices are going to go up. In the Journal of Generic Medicines, there was an article in 2012 that was published showing that the Jordanian government pay an extra 18 million US dollars a year for procurement of medicines, and that's only what the government spends. So, you know, other things that the public spend on more. So there's that, and also under the NAFTA free trade agreement, Canada is being sued by a big pharmaceutical company called Eli Lilly, and all Canada wanted to do is protect its people. And in this case, there was a drug for attention deficit hyperactivity disorder, ADHD, and they'd only tested that drug on 22 people. So what Canada did was invalidated that patent and said, you can't sell this drug in Canada, you've only tested it on 22 people. So they were protecting Canadian health, and voila, Eli Lilly sues them. And Eli Lilly sues them because they're not making enough profit. So this is also what's included in the trade agreement, that we can be sued for protecting Malaysian health.
Okay. Looking at the discussions we've had a few days since we started, I think on Wednesday, we've heard lots of criticism on the TPPA. Would you be able to provide us with an alternative, saying that we have to move forward, we have to be part of the whole global trading community? If we were to forgo with the TPPA, and maybe is there an alternative to it in terms of making sure that we move forward, do a trade agreement, and also at the same time making sure that health and issues such as patented medicines can be resolved in that sense?
Well, I'm not an economist, but there are opinions that it would be better for us to engage in trade agreements with Asian countries, and that would make us gain much more, and we wouldn't have to comply with everything the United States wants. But the TPPA, if it has excluded things like medicines, which trade should not touch, things like environment, which trade should not touch, I don't see why, when all of these things that impact our lives and our livelihoods and our health are taken out, and if it's purely trade, I don't see why it can't go forward. But then you've got to think about the fact that there's 29 chapters and only 5 or 6 are about trade in the TPP.
And I think we should also talk about the investors to state dispute settlement. You've mentioned something just now about Canada.
Yeah.
And will this be also included in the TPPA? Do you foresee that?
Yes. I've heard some positive things about this being a scary thing from people who have some say in this. So I'm going to maintain a positive stance on that. I'm hoping that they will say no to ISDS, because ISDS is a real threat to sovereignty. You can't regulate. You regulate to protect health, you get sued. You regulate to ban junk food advertising, you can get sued by the junk food company. So it's quite bad, and we should take a lesson out of Australia's books, because in these negotiations, Australia has excluded ISDS because they are under heavy litigation internationally under ISDS for tobacco. So they said, no way, we're not agreeing to it anymore. They've got it in their past agreements, but they said, from now on, we're not going to agree to it, and we need to take a page out of their book.
Okay, and lastly, what can we expect from the Brunei round, which is happening next week?
We can expect that a lot more chapters will be closed, I think. There'll be a lot of Japanese there because it's the first full round that they'll attend. And I'm a little bit worried about the Japanese because they've got very strong intellectual property provisions, which would make our situation harder, maybe. So that's what I'm worried about.
People are saying that they might just ratify, that might be the last round before it's ratified or it's agreed. Do you think that will be the case for Brunei?
I worry that it will be. The rumours are that Brunei might be the last full round, and then after that they might just have bilateral meetings between countries and intersessional meetings.
Japan only has one session, so how?
Non-full session, yeah. I don't know how many bilateral meetings they're going to have with, say, US and all that, but I think this is, it's scary because Obama's coming in October as well, so everybody has to be geared up for Obama's visit. Yes, that's right.
Thank you very much, FIFA. Tadi Fifa Rahman, Pengurus Polisi Malaysian AIDS Council, membincangkan tentang ubat umum ataupun generic drugs dan juga kesannya jika TPPA dilaksanakan di Malaysia. Kita akan berhenti berehat seketika, kembali selepas ini.